My name is Lisa Beck. I'm a clinical nurse specialist at Mayo Clinic in the Department of Physical Medicine in our spinal cord injury program. Persons with disabilities have several different steps they need to consider when such a disaster strikes, like who is going to help them? Do they need help even moving from their bed into their chair to evacuate to a shelter or to a safe place in their home? Where are they going to go? Should they have to evacuate from their home? Is it going to be a place that's accessible for them? How are they going to get there? Do they need certain transportation that accommodates their power chair? And what kind of things do these folks need in their emergency preparedness kits? Many times, we're informed of having a food kit, having water, maybe galoshes, and a cell phone and radio. These folks need to take it a step further and think of their medication needs. Think of their daily cares that they need. How do they empty their bladder, manage their bowels, if they have any wounds, additional supplies they might need to maintain for 24 to 48 hours should they be evacuated from their house. We have developed patient education materials for our spinal cord injury population and our general disability population, which includes brain injury, cognitive disabilities, pediatrics with disabilities. So our education materials really focus on a gamut of disabilities, including those folks that are blind and deaf as well, and thinking about some of the different additions to their plan that they need to assure is available for them. Persons with disabilities at home really should start thinking about what kind of grab-and-go kit they need. What do they need should they need to evacuate into a safe shelter place in their home, or if they have to evacuate their house, what do they need at hand in a hurry so they can maintain 24 to 48 hours outside their home setting. For those folks that have service dogs, that's another consideration. Where are you going to shelter? Red Cross shelters do allow service dogs, but you have to be responsible for your service dog, so you need to consider what kind of things do you need to bring with you should you need to evacuate with your service dog. What kind of a leash, food does your dog need as well to prepare a quick evacuation. Depending on the person's disability, a grab-and-go kit would include things someone would need for the first 24 to 48 hours. I would include a flash drive with your medical history, maybe a list of your medications, medications for a couple of days, catheter supplies, first aid kit, wipes, extra pair of glasses, any dressings you need, hand sanitizer, alcohol wipes, or even some pads to protect your bedding. Would just be some initial items to put in a grab-and-go kit for a few days to get by.